So I wanted to start off just to talk a little bit about who RemedyConnect is. RemedyConnect has been in business for over 20 plus years, and we're a one-stop shop for all healthcare industry and digital marketing needs. We were born out of the desire to simplify healthcare through technology. So we provide services that are a direct extension of your practice, giving you the ability to continue building trust with your patients outside of your office. All of our products and services were developed from a pediatrician's mind and wanted to make every product we made that made pediatricians' lives easier and also get more engaged with their patients. We design custom websites and mobile apps to provide state-of-the-art digital answering services 24/7 as a presence and a voice of your practice, allowing you to give your patients more convenience and a better self-directed care. We provide telehealth, digital live answering service, custom websites, search engine optimization, reputation management, and patient education. And with that, I'm going to turn it over to my partner, Claire, who will talk about telehealth.
Welcome, and thank you for joining us today. The vision for Remedy Telehealth grew out of the RemedyConnect mission of serving as the digital communications partner for practices. As Graham mentioned, our products are designed and built by pediatricians, inspired by patients. We partnered with industry leaders like Google, Twilio, Microsoft in building our HIPAA-compliant virtual care platform. A virtual care platform is really different than video conference. The biggest difference between us and a Doxy or Zoom is we allow the providers the ability to schedule, conduct, document, and bill for televisit all within our platform. Mobile or desktop, you get the same high-quality AI-supported technology. Combine this with our answering service, and we can provide a one-click access to starting a televisit from your mobile device. We'll talk about that more in a little bit. Practices can also customize each step of the process, and providers enjoy Google Medical to speech text dictation when using their mobile app. So just think about it. No more weekends stuck in front of the desktop while on call. At the end of the visit, a fax is sent to your office with the completed progress note and billing summary, closing that communications loop. The highlights of our platform are featured on this slide, and we'll be talking through a few of the providers' features. Our televisit workflow is intuitive. For parents, we have simplified the process of starting a televisit to a simple click of a link. We offer medical article links, which allow practices to build a web-based resource library for parents. As Graham mentioned in our intro, RemedyConnect has been supplying practices with medical content services from the AAP and Dr. Bart Schmidt for years. Providers select which links to send to patients and parents, and they are directed to the articles on your website, and also helps to improve your SEO. Next slide. Our dashboards are designed to be intuitive, informative, and simple to use. We provide staff logins in addition to providers so that staff can schedule from multiple providers, start visits, and collect payment information. Appointments can be canceled or rescheduled from here. The visit link can be copied and pasted into an email that can be sent to parents, and visits are started from this dashboard. Our dashboard also has a reporting section that reports on the most commonly used ICD-10 and CPT codes, as well as time of days and days of week that you're doing your telehealth visit. The televisit history captures visits done by yourself, as well as any of the providers in your practice, allowing you access to their on-call documentation. Next slide, please. Scheduling our visits can be done in either a now or later mode. The view here on the left is the view from the Your Practice app, which providers would be using. Our desktop view is visible on the right. When a visit is scheduled now, a text message is sent to the parents immediately to join the televisit. When it's set for later, the scheduler has the ability to also include screening health questionnaires like the PHQ-9. Co-payment amount requests are also done from this screen. Next slide, please. Once parents select that text message link, they are directed to a patient registration screen, which can be a 2 to 3 step process. Our COVID-19 screening is included, but it's optional and can be removed on a per practice basis. On the left is the first step in the registration process for parents. Any of these boxes can be removed by practices or can be set as required. So if you only want your parents to fill in a first name, last name, and date of birth for the patient and make those required fields, that will complete the registration step for this first step for your practice. Parents do have the ability to upload photos and submit payment information through this process as well. The picture on the far right is that final step in the registration process for parents, where they submit their payment information and provide a televisit consent. Once that's completed, the Proceed button is highlighted, and they move into the provider waiting room. The provider waiting room is unique to the provider, so if you would like your parents to, for example, have a flashlight handy during the visit, you can include that in your waiting room message to parents. Next slide, please. These are examples of the view from within the application. On the left is the mobile device patient view, and on the right is the provider desktop view. Providers have the ability to add multiple participants from their view. That little paper airplane icon indicates the ability to send those medical article links I spoke about earlier. There is a network quality indicator so that you know whether what the bandwidth for your telehealth visit is like. And the progress note is accessed directly from this screen as well. Next slide, please. Our progress note documentation, again, can be customized by practice. In the app entry mode, you can enter information into the note directly from your screen. And from the mobile app, again, you have the ability to use the dictation feature to dictate that note. Anything that's in green has been brought into the note from parent entry. Anything in blue is what the provider entry fields are. Again, which fields your practice displays here is totally customizable, and the template for the physical exam can be modified by the practice as well. When the provider enters into the progress note, the microphone and the camera for the parent are put on a pause phase so that you can do this documentation without the parent hearing or listening in on what you're putting in your note. Next slide, please. Our onboarding process for practices has been simplified as well. Once the service is turned on, an admin practice manager goes through the setup process using the guide for their login. Once this has been completed, emails are auto-generated that provide the login information for providers and staff. We offer no setup fees, no long-term contracts. Our onboarding is done, like I mentioned, by the practice manager. And our services are fully integrated into that Remedy on-call platform to provide that seamless experience when you're on call. With that, I'm going to turn the presentation back over to Graham, who will go through our other services that are part of the RemedyConnect solution suite.
Thanks, Claire. So as Claire mentioned, you can turn an after-hours phone call into a televisit easily by using our Remedy on Call after-hours answering service and via our mobile app. And then you can also get paid for it as well. With Remedy on Call's proprietary answering service software, you can not only enjoy secure messaging, forwarding, starting a televisit, and using masked phone number application, but you can also have full access to a call history and the ability to listen to all your recorded calls. You never need to worry that your valued patients aren't getting the outstanding service that they expect when your team is away. We have a 97% retention rate of all of our clients over 20 years. We're approaching the 2 million calls mark that we've taken. We're open 24/7, 365, and all of our agents are located here in North America. We can also do scheduling in OP as well during the day, so we're not just an after-hours service, but during the day service as well. So we're a full extension of your team. We also have a digital answering service that can pop up on your website when you're away at lunch or after hours, where your patients and parents can log in, type in a message that they want to deliver to the on-call provider, and that information will be saved for later so that when they use the system again, their information is already in there. Once they click submit, our rules engine will determine who is on call and how they want to be connected. Once they receive the message, they can then reach out to their patient or parent. Our secure messaging is through our mobile app. And again, you can mask your phone number for privacy, also start a visit, and take notes. You can also securely forward a message to another provider in your practice. Our system is fully customized based on the way you want to be connected. You can get a text message, a voice message, an automated message, a secure message, and it's also fully customizable on the time of day, hour of day, and when you want to be contacted. We have an online roster that you're able to update real time. That way you always ensure that the message is being delivered to the right person at the right time. The nice thing is also you can get the full call history and the option to listen to all your calls to make sure that your patients are being handled in the way that you'd like. Some of the examples of how our clients utilize our services. We have a really large practice in Florida. The problem that they had was they were just extremely overloaded with calls. All of their calls were being taken in-house, and they were actually missing 70% of their calls during working hours. So they weren't able to book appointments, take prescription refills, making patients very dissatisfied with the service that they were getting. Our solution was to provide a solution that they could call in during the day, and we could log into OP and schedule appointments for them, and making sure that their schedules were continued to be booked. We also had a practice in Texas that did not have an existing software answering service, and they were just having all calls forwarded to their cell phones, their private cell phones. We provided a buffer space for that so that during after hours, we could route the calls to the specific appropriate staff. That way, their personal cell phones weren't out there for everybody to have. As mentioned, all of our services and products are combined together to make an all-in-one solution. Our mobile-friendly custom websites are a unique perspective of your practice, a window into your practice that are fully optimized, scalable, and easy to update anywhere, anytime that you have internet. They also come with a semi-custom mobile app so that your patients and parents can go to the Google Play Store or the iTunes Store and download the mobile app and have it on their phone at all times. Just another way of engaging with your patients and keeping them engaged with your site. We also have dedicated team members that are trained on the latest search engine optimization requirements as Google and other search engines are always constantly changing their algorithms on how to rank a website. We make sure we keep up with pediatric market trends and keywords to make sure that you're showing up in the top search results. We're also able to increase online reviews and reputation with our review builder service, which I'll go into later. One of our best features that differentiates us from our competitors is our patient education. Dr. Barton Schmidt's Is Your Child Sick content is hosted on all of our websites for your patients to access during or after hours to get the most customized experience for them and their after hours needs or medical content that's trusted and provided by their pediatrician. A little bit about our process when creating a new website is we meet with you to create a customized unique website that shows your personality and your practice. We use best practices when using analytic tools and market analysis to make sure that your website is easy to navigate and easy to use so that people can find what they need quickly. Our designers will create 2 mock-ups of what your website could look like based on your interaction with the designer. And you get to change or update those designs until you're 100% satisfied with your design. We then code your website to make sure that it has a strong foundation of code and search engine optimization. And then we deliver that website to you that can always be updated anytime, anywhere you have an internet connection. And not only do we deliver that, but we also devote our time after that to making sure that we update your website in keeping up with Google's and other website search engines, I should say, algorithm changes to making sure that you always show up. Our mobile app is tailored to your practice. So you can see here, there are 6 customizable buttons that are directly integrated with your website. So if you update something on your website, it'll automatically be updated on your mobile app as well. So there's not 2 places for you to maintain. I think we mentioned earlier, there is a patient and a provider side. The provider side is for your after hours answering service. And the patient side, as you can see here on the screenshot, is an easy way to engage with your patients. There are 4 buttons at the bottom that are commonly used. So you can click to call the office, you can get directions to the office, you can easily pay your bill, and get new news and notifications. A big reason why a lot of our clients come to us is our industry-leading medical content. Dr. Barton Schmidt's Is Your Child Sick content has 187 articles that are easily read and easily used. Even me as a parent of a 7 and a 2-year-old, I have used it multiple times because it's a trusted piece of information from my pediatrician. I don't have to go on to Google and search for a commonly used word that will yield millions of results that all say different things. I can go to my pediatrician's website and find the answer that I need. What's also nice is we include all of the American Academy of Pediatric articles on your website as well. So before you've even added a single piece of content to your own website, you're at 1,000 pages of medically content related information on your website. Not only from a search engine optimization perspective, but also from a helpful perspective for your patients and parents. We also have the Are You Sick adult version content as well that you can place on your website as an added resource. We can also include the kid site videos. As you can see here, there are 5 different categories, and these videos are between 30 and 90 seconds long that explain complicated issues or health-related issues to children, making it very easy for them to understand complex issues. What's nice about all this content is it lives and breathes on your website. You are not linking out to other websites, which just tell Google that you do not have that information on your website, but rather you have to send somebody somewhere else to get that information. So Google rewards you from an SEO perspective from having that on your website as a valuable resource. Our reputation management platform called Review Builder is an extension to get your practice more reviews online. They're saying now 72% of patients say their first step in finding a new provider is checking online reviews. Most people will go on to Google to see what reviews are saying about your practice. And more often than not, it's your word of mouth reputation. The way that the system works is we're able to text message your patients out that you saw that day to ask for a review. When they click on the link in the text message, it'll bring them to this Review Us page. If they click 1 through 3 stars, you actually are able to provide them a custom patient experience survey where you can ask whatever and however many questions you want to a less than satisfied patient. Once they click submit, the only thing that happens is an email is generated to you or whomever at your practice needs to see that information to get a better understanding of what may be going on within your office. This information does not go public. It's for your eyes and your learning purposes only. The other benefit to this application is the 4 and 5 stars. When a 4 or 5 star reviewer clicks, they actually get redirected to your Google review page within 2 seconds to leave their subsequent review there as well. As you can see here, just as an example, Cressley Pediatrics, when they started with us, had 11 reviews and a 4.0 star rating. As of today, they have 203 reviews and a 4.9 star rating. Now that's multi-beneficial not only from a online reputation perspective, but also an SEO perspective, as 25% of Google's overall ranking algorithm is solely based on number of reviews, number of recent reviews, and positive reviews. So the more positive and recent reviews that you have, you're going to show up above and beyond your competitors in your area. Now we offer 3 different SEO findability programs as well. And what these do is improve your local findability. What we want to do is make sure that you're ranking higher than your competitors. We want to make sure that we're improving the overall organic traffic to your website as well. So not just people that are typing in your doctors or providers' names or your practice name, but typing in keywords such as pediatrician near me or best pediatrician in my area. Those are the types of keywords or long tail keywords that you show up for in a search engine result page. We also want to create brand awareness for your practice as well. So we do the keyword research to find out what keywords are being searched for in your local area and for your competitors to make sure those are organically included into your website as well. The entire goal and program is to make sure that you grow your practice and attract new patients. So we want to make sure that we're increasing monthly leads and making sure that your appointments are increasing as well. With our Review Builder application, we'll be generating new patient reviews so that people can read how they're going to be treated when at your practice. We also provide social media posting so that you can keep up with your Facebook or Twitter or Instagram audience as well. What's really nice is we create a visual dashboard for your website. This way you can make sure that the work that we're being done on the back end is working for organic traffic. This will visualize many different aspects of your website as to what keywords are being searched in your area, the top pages that are being viewed on your site, and those are the pages that you want to concentrate the most on when updating content on your website. You also want to ensure that the organic traffic is the most amount of traffic that is coming to your website, as those are the people that are typing in keywords that are finding your website organically. all of our programs help to boost your SEO and show up at the top of search engine results page. And with that, I'd like to turn it back over to Kimmy for questions.
Awesome, thanks, Grant. Before I jump into the questions that the audience submitted, I do want to remind everyone of a few items that I brought up in the beginning of this. By the end of this week, all attendees of today's live webinar will be receiving an email with a copy of the presentation they just went through, as well as a recording. When you close out of today's event, you'll receive a very brief survey. Please take a few minutes to provide your feedback on today's event. And if you would like to request follow-up on any of the products or services you heard about today, you're able to do so during this survey. So Graham, Claire, and Bethany, feel free to turn on your webcams for our Q&A section. Perfect. And let me hop in and see what kind of questions that we got from our audience. How long does it take to create a new website?
Yeah, great question. So we say it takes between 6 and 8 weeks to create a website from scratch all the way to live. And that depends fully, as we create our websites custom to each practice, it depends on the interaction and the time you have to meet with our designer, which is a very 30 to 45-minute call to come up with that initial design, and then another 30-minute call to go over the 2 mock-ups that they create for your review and your changes and updates until it's ready for design or for coding. So 6 to 8 weeks is usually a general time frame.
Cool. Someone else asked if their existing site is live, up and running, while the new one is being made, if there's any downtime, or what the process is there.
Yeah, so there would be no downtime. So we would, at the point that your website is ready to go live, we would make a simple, what's called a DNS entry change on your domain. So whether that be www.abcdpediatrics.com, we make that switch, and within 10 minutes, your website has fully changed from your old website to your new website with RemedyConnect. No downtime.
Perfect. Okay, this is a question that just came in. What screeners are developed by the mobile app for telehealth visits? And are these screeners also available for in-person visits?
Right now, we have the PHQ-9 as the screening form that's available. We have the ability to create more and are looking for input from practices as to what would be most helpful for them there.
Awesome. Can the medical content be added to any website, and is it editable?
Yeah, so what's really nice is even if you don't have a website that's built by us, we can still add all of the Is Your Child Sick and the AAP medical content to your existing website. That way that, you're able to present that information as a useful resource for all of your patients and parents. Oh, and yes, some of the articles, as in like the medicine dosages, are editable, but the rest of the content that's provided from the AAP and Dr. Barton Schmidt is not editable.
Got it. Looks like along the social media offerings, someone asked if you can help with building from scratch their social media platforms.
Yes, we can. We do that kind of on an a la carte basis, just depending on where you are today, and we do that, specifically customized quote for you, just depending on how much involvement you want us to have. But yes, we can create from scratch or take what you already have and boost it.
Perfect. So that looks like those were the questions that our audience did submit. Before I give 30 minutes back in everyone's day, I do want to open up to our 3 panelists here. Is there any other comments or items that any of you would like to mention for our audience, or key takeaways, anything that you just want to leave them with?
I just want to say we're super excited about this offering and we're looking for client input. So I know several customers that have both OP and Remedy solutions. So we want to hear from you. So you'll see the contact information that comes out to you. So reach out to us, and we in product can't wait to hear your ideas. So thank you for joining us today.
Yeah, we really appreciate it, and we are really happy to be a part of the OP team and looking forward to, again, what Bethany said, is just learning from you guys and making more products and services that make your lives easier.
Awesome. Well, I would like to thank our speakers again and thank all of our attendees for joining us today. And I do hope that you were all able to learn a little bit more about the RC products and services. And again, if you would like any sort of follow-up, make sure that you fill that out in the survey. If not, please enjoy your day and have a great week.
Thank you.
Thank you.
Thanks.